It's recording. I thought we'd do an affirmation tonight for the children that uh, got hurt in the school in Texas today. I thought it was appropriate. So, uh, would you like to do something, Linda? Just something
Howard,
to.
would you like to do it? Or Richard?
Does someone want to
I,
do it? It's not what I'm good at.
or Jerica, did you hear about it?
Yes, I did. I was watching it this morning or this afternoon, and then it was on the 5 o'clock show news.
Yeah.
I just got in on the tail end of it. Would somebody like to do an affirmation about it? Something?
Yeah, so an 18-year-old resident there of that community, he went to the elementary school, the high school, graduated there. He murdered his grandmother, and then, here, Andy, will you take him? Proceeded to go to the elementary school where he went in with a handgun. They have not confirmed as of the 5 o'clock news if he had any other rifles or anything with him.
He did.
And he shot and killed 14 students and one teacher, with 2 additional students in the hospital, with many more. There's just a lot of unclarity and uncertainty right now.
And we keep all those families in our prayers.
Yes.
Okay. And then before Jerica leaves, we had a great barbecue up at her place. There was Tushar and his wife and baby. There was Jack. We took Jack up there. He was sort of coherent. He'd worked all night before. And it turned out to be like 62, 64 degrees up there. So Jerica had to loan us some jackets to wear. And then this afternoon, you want to give us the good news, Jerica, what you did?
What? Oh,
about
today?
Melinda.
Yes,
Yeah.
Melinda and her husband, we officially transferred them over. So they are new members to Rotary E-Club, joining us from the Sunrise Arlington Club.
Oh, good news.
So,
We
welcome,
got that
welcome.
switched over.
Oh, and I have a question for you. I have a bunch of people that are like interested in coming to meetings to see if they'd like to join. Is there any way to get them on the mailing list so I don't have to manually send something out to them each week?
If you send me a list, I can try to, let me look and see what's in Club Runner, if I can create a separate mailing list.
Right, because if I have to do it manually every week, and it would be easier if I could just push a button and it would all go to them. Some of them will eventually become members, but I'm trying to encourage them to show up. That's really
No, I think we should be able to have a subscribe to our newsletter. So let me check that out.
Thank you.
All right, well, thank you guys.
Okay,
Thank you.
Maria's on the
Maria.
line. Hi, Maria.
Did you want to do the pledge?
All right, we just started our meeting.
Yeah.
There's 4 of us,
Yeah.
5 of us. Or was 5, now
Wait a
there's 4.
second till she's off the phone.
Well, Linda's
Where are
right
you at?
next to me.
215-550-7131?
Okay. So Richard, I was just asking you, was the
Oh, wait a minute.
evaluations
Just a minute,
you asked me to
David.
do,
Put her.
did they line
They're in the
up
waiting
well?
room. David hasn't let you
I
in.
don't see them.
They're in the waiting room.
Both presidents are talking at the same time. President Berg and President Linda are both talking at the same time. Why don't you mute yourself so we don't hear your personal conversations, Linda?
It's with a meeting, and she's trying to get in.
Okay,
Okay,
You have
bye.
to tell us about it.
Well,
There we go.
Okay. So Richard, what I wanted to know is with the evaluations that I sent you, did they line up pretty well with what everyone else did? Because I've never done that before, and I just wanted to know if it was accurate.
I didn't really compare it that way. I thought you were fine.
Okay, I just, I've never done it, and I just wanted to know, because you've more experience, whether the choices I made seemed appropriate.
They were appropriate if you looked at each one and said, this one's the best one.
Yeah,
I
but
trusted you
I
to
was
do
just
that.
trying to see what everyone else's judgment was, because I had no background or experience to compare it to, so I was just going by instinct. And I thought, because you've seen this more than I have, you could see if it was in the right ballparkers.
Actually, one of the reasons I even selected you is because I felt like you didn't really know a lot of these people.
No.
So you couldn't be prejudiced. You had to look at them and
Well, I
give
knew
it to them.
Bill. I knew Bill Dendy, and he was on a lot of those. But Bill does so much. I didn't have a problem considering him for anything because he's so charitable to the organization.
Well, he's one of our top 3 governors in the last 25 years.
That's what I thought. That's what I was saying.
The other two are on the screen.
Yeah. Oh, while we're talking
Just
about
kidding, just kidding.
while we were talking about Bill Indy, we went down to Georgetown Thursday night and for the Lynn Greenwood Patriot Awards, and Bill was honored as a Lee Greenwood Patriot.
What is that?
And that's
So where's the photograph with you and Lee?
I've
They
not.
took it.
They took it, but it was they wouldn't let me individually take it. I had to go through the professional photographer. Charlie was also there that I invited, and then Sonny Sharma also got the award last night in Spring, Texas. He's the chairman of the board. Another Rotarian is the executive director from Houston.
What
So-
is it? What is it? What is it an award for?
It's Lee Greenwood. It's helping a hero.
Their
And-
immediate goal is to build 100 houses for wounded warriors
Oh,
that have disabilities where they need
Adaptive.
special equipment in the house.
okay.
Yeah. The houses are adapted to their needs. And Bass, who now owns Cabela, they have said they would buy the first 4 houses and then they'll pay 25% or
25%
25% of the
remaining
cost
houses.
of the remaining 70 house or 100
Very
and
nice.
whatever.
Very nice.
So anyway, it's a real nice thing. We went to it last September here in Dallas, and Shiloh Harris was there, and I talked to him, and he's going to be at our meeting at Richards. I told him we'd do it on Zoom, and we were going to also, he said, I'd rather be there. So Richard Shiloh Harris, who is the wounded warrior from the Iraqi war, will be at your house on July the 12th. So
Is
we
that
will
the
soon.
president-elect? Is that the new district president?
No, Shiloh? No, you're the new district president. Oh, no, Shiloh Harris is a wounded warrior.
Okay.
You're the
Right.
district, you're the next president of our club,
By
remember?
No,
wounded,
according to the district governor.
That's a governor. No, the governor is Howard Templin.
Oh, right, Howard.
And I've been asked to be the Rotary Youth Protection Chair.
Oh, how nice.
Yeah. So, anyway, and that's about it. So if you want to get on, I think, there was one new polio case this last week, and that virus has been linked to the previous case in Malawi, which had come either from Pakistan or Afghanistan. I forget which one. But anyway. So, Charlie, are you ready?
I certainly hope so.
I want to thank you
Okay.
for coming in at the last. Our speaker got sick, so Charlie stepped up to help. I just wanted to thank him.
Okay. And also, Howard had the virus, and he's over it now.
No,
And now
I'm
Vicky
not.
has
I'm
it.
not over it.
Shouldn't he be wearing a mask
I'm
then?
still.
Yeah.
I'm recovering.
Shirley, for you.
All righty.
Okay.
Okay.
Okay, I'm going to mute my microphone. Linda, can you introduce him and talk about what he's going to say? Because you're more familiar.
Okay. Okay, basically, Charlie Wasser is with Rotacare, which they're building free clinics, and right now it's in San Antonio, but they're building them across. He's got a lot done in California, where he used to live, and he's just recently, in the last year, moved to California, to Texas, and I saw his presentation about a month ago down in San Antonio. He belongs to the Mission Trails, and we will go visit his club. I guess it'll be next Tuesday night when we're in San Antonio
Are we
with our friends from
recording?
we are recording.
Where does it say that?
Howard is.
I'm recording.
So that's it, Charlie. Thank you.
All righty. Now, hopefully you all can see the slides.
Yes, we can.
I finally got it right. It's always back and forth when I try to do this. Anyway, good evening, everyone. Last time I was here, I was watching one of your speakers. And Linda just called, and Linda's a good friend, so I have to say yes to give the presentation. And basically what Rotacare is, quick overview, it is a bunch of free clinics. It's a process that started in 1989 in the California, San Jose Bay Area. And to show you how much hold Rotary or the Rotary's attorneys have, it started off being called Rotary Cares. And it took Rotary 3 years to catch on to it and said we couldn't do that, but they compromised on RotaCare. And it operates on a similar model as ShelterBox, if you know what that is. With ShelterBox, they are not an official part of Rotary. They have some new agreements with them now, but they're still a separate legal entity, and so are we. But most of the people in leadership roles in RotaCare are Rotarians. So it's the same thing, makes it easier for us because we don't have to worry about applying to Rotary and doing whatever Rotary action groups have to do. Anyway, the basis of RotaCare. Hang on a second. To develop, support, and enhance the delivery of free medical care for the relief of pain and suffering to those people in the most need and who have the least access to medical care by establishing and supporting free clinics to provide such medical care. Now, one thing that I did kind of skip over before, our vision with this, and this is something that's been going back and forth for 30 years, and we finally started pushing, and we had some restructuring of our board. The original plan was to have an overrule, for lack of a better term, an overruling board that would help establish these clinics nationwide. My goal is still to do this nationwide, but because of certain practical issues and differences of the way we wanted to approach this, you would have seen on my first slide, I should have pointed out, where it says free medical clinics across Texas and Oklahoma. That's my first goal. I met a lot of clubs, clubs such as yours at Lone Star Pets this past year, and there's at least 31 clubs that are asking for presentations. So I decided to redefine my area to be Texas and Oklahoma. And Dr. Tam Nguyen has been a doctor or had been a doctor with the Bay Area for the 32 years. And he says that some of these patients have received almost no care before, so you can see a dramatic change. In other words, working with the patients. The type of patients they have, extreme case. It's a clinic that is in downtown San Antonio. And it's in I believe it's a Methodist church that has converted their mission to work with the homeless in San Antonio. And for 20 years, every Sunday morning, they have a clinic for 4 or 5 hours where the members of the homeless community, or from California, they're called the unhoused community. I don't know if that's nationwide. Nonetheless, these people were lined up waiting for the medical care. They know it's coming. And I think they also get meals there and whatever. So the church has become quite a shelter for them. But the main thing that we're talking about here is the clinic. And again, people like that are living on the street like that, couple of months, couple of years, obviously would not be able to afford the health care or the insurance. So we give them free medical care. Part of the backbone of all this is to make arrangements with surrounding hospitals and medical schools so that if indeed somebody needs to be referred to more care, it's also free of charge. Quick map of where our clinics are right now. There are 3. Well, there used to be 3 in Puget Sound. Part of the problem with these clinics is we have to find doctors that are willing to stay with us. In the case of Puget Sound, 2 of them were run for about 20 years by the same 2 doctors, and both of them, unfortunately, both passed away at the same time. So it was very hard, especially in the last 2 years with COVID, which has also slowed my progress. So in Puget Sound, they're down to 1 clinic. Hopefully we'll be able to reopen some more. In California, where you see the whole bunch together, that is in the San Jose, San Francisco area. There are 10 clinics there. There used to be 15. They do come and go. Again, it's all volunteer. Nobody's being paid anything for this, for their work. In the western part of Texas, that's El Paso. And that was started by the El Paso Rotary Club. They opened up in 2014 to celebrate their 100 years as a Rotary Club. And they are on the campus, called a campus of a Lutheran church in El Paso that just happened to have an extra building laying around. And they charge the clinic $1 a year rent, I guess for whatever legal reasons, for the lease. And the Rotary Club went in, gutted the building, and made it more into a clinic. That is not something that has to be done, but in their case, they were going to do it anyway, so why not? On the East Coast, you'll see one in New York. That's on Long Island. That's been around for about 20 years. And the one below that is Maryland. I just opened that about 6 months ago while we were trying to hit the whole country. And the young lady that is running the clinic in Maryland said the district governor in her area, in her district, is a psychiatrist and wants to open 4 or 5 free clinics in Baltimore. So Rotocare will have a bigger presence there. Now, what I'm going to be doing, what I'm looking at doing is opening at least 4 in the San Antonio area. The presentation that you're going to be seeing, the rest of the presentation, is one that I gave to my club, which is Mission Trails, San Antonio Mission Trails Rotary. They had given me a grant out of a major fundraiser that we do. And they were just looking for, so we gave you this money, what's going on with the money? So a lot of this is going to be aimed around San Antonio. However, this will be applied around the state of Texas and Oklahoma. And if you guys want to get involved at some point, or if you know of clinics or clubs in your area or your district, this is the kind of model we'd be using. So basically, what are the medical services that we give? People come in with cuts, they have pain, they have diabetes. In some cases, they don't know they have diabetes. And part of what I'm looking for is someone comes in and has a cut, and we'll say, okay, let's kind of screen you for diabetes. Let's screen you for high blood pressure. Because again, these two are serious illnesses that really don't always show signs. So that somebody that's going to have that problem, won't show up. Diarrhea, fever, dermatological problems. The example I gave with the church in downtown San Antonio, they were taking me on a tour. And this fellow who probably retired 15 years ago as a dermatologist came back to work at the clinic. He's been working at the clinic for a number of years. And he was working with one of the homeless patients who probably had a scar about 6 to 8 inches on his leg. And the doctor was helping to relieve the pain and to remove it and do whatever to help the fellow feel better. So I had a chance to see some of that work. Pharmaceuticals, the goal on that, and I was told that it worked in Puget Sound, is near the clinic so that people don't have to take a bus or whatever. Excuse me. Near the clinic, we're going to make an arrangement with a pharmacy or with the overlords at CVS and Walgreens, so that our patients will be able to go to the clinic with the script, get their drug for free, and then the Walgreens or CVS or the local pharmacy will bill us in turn. And if I do my job right, if I'm the one doing negotiating, the pharmaceuticals will come in at a lower price. So that would be our way of saying, this is your way to give back to the community. But they would have to keep track of what they're giving out for free. Preventive exams, that's what I was just alluding to with diabetes and high blood pressure and other types of issues like that. Oh, and by the way, I do have a tendency to speak quickly. If you want to have me repeat something and go, wait a minute, I don't understand, feel free, just jump right in. The next step in this, as this evolves, we're going to be adding what's called social determinants of health. And we're going to look at this, calling them access points as opposed to just clinics. In other words, the people that are coming in for the free medical care more than likely are going to have food issues, housing issues, child care, mental health issues that are ignored, their physical environment, living on the street, the medical care again, health education, which would be the screening and teaching them about the diabetes and blood pressure. And on the last one, the World Health Organization is developing a plan to eradicate, or they've got it underway to eradicate cervical cancer worldwide. So we've started a trend, because you go back historically, Rotary went to the World Health Assembly, which was part of the World Health Organization, and they said it's impossible to eradicate a disease and it's impossible for a service club to eradicate a disease. So I guess we showed them. So they're working on cervical cancer. There is a Rotary Action Group called the Health Education and Wellness Rotary Action Group that is working with whom more directly than I had a chance to do. And you'll probably start hearing about it nationwide in Rotary, about educating people about cervical cancer and how it can be prevented. Admirable goal. But just keep in mind, though, more than likely the idea of somebody saying, hey, let's eradicate a disease on purpose, that came from Rotary. Okay, so the organizations that we are involved with that are partnering with us and will be involved with the RotaCare's expansion. Health Education and Wellness Rotary Action Group is the one I just mentioned. They have educational programs. They will be at the convention in Houston if you want to go talk to them. The National Association of Free and Charitable Clinics, similar in concept to the Texas Association of Charitable Clinics. Basically, they're trade associations that allow, they're in a position to look for group purchasing power, getting grants. The Texas Association of Charitable Clinics, when they were selling me on the concept of joining, said they had gotten a certain amount of money and they picked out certain clinics. One of them was El Paso, and they were going to offer them $2,000, just here's $2,000 to be used on the pharmaceutical costs. The point of this and the very importance of that is there are organizations out there whose purpose is to make free medical care possible. Let's see what else. So it's okay. And then the last one, Rotary clubs and districts and zones. When I went to PETS, I was working with zone type application with the districts, a bunch of districts there. The zones, I went to Houston in September to talk to the training that was going on. It's at the Zone Institute where the governors get trained, and just started getting some PR on that in the Rotary clubs. As I'm doing here, I make individual presentations. And in case you were wondering how much money does Rotary clubs give up since its inception, Bay Area and the San Jose area, these are the clubs and districts that have donated to RotaCare. There's about 79 of them. Well, 76 clubs and 3 districts. And I forgot all about the Rotaract clubs in there. So that these clubs do that. And I say that in such a way that if a club wants to get involved, I'm not here saying that, oh, you guys got to do this. But if you do want to do it, you do want to step up, we have systems in place. Or if you have another club that's willing to do it and take the lead on it, you guys could help them out financially. Again, if you want to do it. Most of what I'm doing here is to just spread the word that we exist. If you know doctors, if there's any doctors, nurses, pharmacists in your club or any of the clubs that would want to be involved, that would be a great help. Because again, I'll get into a little bit more, but I expected to have at least one clinic up about a year ago. And the problems I ran into is this little nasty virus called COVID. When you think about it, but wait a minute, you're putting together a medical clinic that's going to help people with illnesses. It's like, yes, but COVID was such a priority for doctors that they just couldn't do it. Because again, we asked doctors to volunteer. Okay, our financial status. Now, some of this, again, is because of COVID that it's taken me a little over a year to get. But what you see is the $20,000 from the medical foundation. As it turns out, my primary care physician is a member of a family that owns, at this point, 7 clinics in San Antonio. And the father that started it, I think in 1960, his parents were Mexican immigrants, gives back to the community. And they said that they'd started a family foundation about 6 months ago. And for the first year, they would give me at least $20,000 for the clinic. These clinics will cost $20,000 to $30,000 a year, depending upon location, depending upon, for lack of a better way to say it, how popular they are. If a lot of patients come, if there's need for the pharmaceuticals, and also for the tests. Somewhere along the line, you got to pay for tests. I got $1,000 from one of my board members. And again, as we start getting ready to spread out, I will be asking people in your area to sit on the board. It would be a statewide board. But in this particular case, the $1,000 just got sent by a foundation that he's part of. It was a personal donation. He didn't even tell me he was going to do it. There's a Rotary Club in 5840 that donated $5,000. My club, small club, donated $1,500. And then where it says free medical equipment from Medical Bridges. When you think in terms of, is there any reason to go to Rotary events? To me, I'm always going to remember this. I went to Houston to the Zone, and I wasn't very happy with the location of the table they were giving me to talk about RotaCare. some people that know me, Linda has seen me at Pets in Texas or in Dallas. Luckily, we never had to deal with it, so she doesn't know my nastier side to the man. Anyway, so I kept pushing, and they put me next to a group called Medical Bridges, just coincidentally. Medical Bridges for the last, I think it's 20 years, 25 years, has been locating excess medical equipment and donating it around the world for free outside of the U.S. It turns out that at this point, they want to start giving back in the state of Texas. And they were looking to work in the rural areas, rural medical areas, because there's not much care in Texas in some of the rural areas. It's one of those things we need to work on. One of the things Rotacare is going to do. But again, the relationship that I built with the CEO of it, he agreed that his first level of expansion is going to be to put up a warehouse in San Antonio. So that would be central to a lot of areas. If things were to move in Dallas and Dallas area, I'm sure we could convince them to put a warehouse there. But he wants to be able to cover Texas. And I'm sure since Oklahoma is so close that we'd be able to get him involved. Now, the last one is key to me as far as a little bit of ego, but also very, very important for PR. And I'm big on PR when you're trying to drive these things. There's an organization in San Antonio known as the San Antonio Area Foundation. It's been around for 60 years, and it gives people a way of having a 501c3. In other words, they're the umbrella 501c3 without setting it up. Like the gentleman that gave me the $1,000 up front, he has an account with them, and this is how I found out about the foundation. The foundation was the one that wrote the check for him, even though it was out of his funds. But what we would be getting with them is they would be taking our donations, and they would also be looking at our books and advising us and sitting on the board if we wanted them to do that. One of the neat things about this foundation is they're large enough to take their clients' money and invest it. And they usually average about 4 to 5%, which these days is pretty good. So I'm pretty happy about that. The other one is all of their funds, and we would be considered a fund, is listed on their website. So that if somebody in San Antonio, or actually as we expand into Texas, they said that they would be able to help us out. So again, the Dallas area, Houston, Austin, whatever. Someone goes on the foundation website and they're looking to donate money, and they say, oh, free medical clinics, and they want to donate money. So in theory, people get money from generous donors that they don't know. It's just people that are out there willing to give money. And here's, some more. This is what I was just talking about with the San Antonio Foundation. They've been in existence for 60 years. They serve as the 501c3, which means I don't have to go through the legal or accounting problems of having it. They will also file our taxes. They invest funds. They list nonprofits, and the management advisory. So all things I've just gone over. But the fact that it's been around for 60 years and it's known by a lot of rich investors, people that are giving back, adds to our credibility. And that's where I say my ego, forget the ego part. This makes us real in the financial realm, as far as I'm concerned. And when I went out, one of the things I learned when I was still in San Jose is that elected officials, those that haven't joined Rotary yet, get very excited when you go to an elected official and you say, I'm from Rotary, XYZ Club. What can we do for you? Not, hey, we got the idea for a project, but you come in and say, what do you need? And you'd be surprised how much they list and how many phone calls you get. The first clinic is going to be in a church that I'll get to in a few minutes, but I met County Commissioner Rebecca Clay Flores. She is in Bexar County, right, actually my representative, I didn't know that, but the church was on the other side of Bexar County. She is supporting us, at least emotionally, and said there's a chance of getting money. Patty Hernandez is her outreach coordinator, and Patty sits on my board. Council member for District 2, which is where the first clinic is going to be, Jalen McKee Rodriguez. His office is involved with it, and his assistant, Jolene Garcia, has pretty much specified that when we're ready, they will find us money to assist us. And then the San Jose Local Health Authority, also known as the medical director for Bexar County and for San Antonio, Dr. Junta Wu, is on my board. And here's an example of where COVID got in the way. Last January, February, I ran into her through whatever networking I was doing, And as we were talking, I said, I'm the kind of pushy person that says, I think I need you on my board. Do you want to come to the next meeting? And she laughed it off. And she said, I can't do it because of COVID. Again, COVID came up. What she said was, if you can show me how to not spend 95% of my time on COVID, I'd be glad to join. A couple months ago, 2-3 months ago, we were on the phone for something else. And she said, oh, by the way, that offer you made about me being on your board, I'd like to accept that. And she also has one of her assistants, as she calls it, one of her lieutenants, who comes to the board meeting when Junta can't make it. So the government is out there willing to help with these things too. The 3 locations that I've got lined up, the first one that we're going to hit is the Ephesus Seventh-day Adventist Church. That is a black church in one of the poorest areas in San Antonio. The pastor of the church was over the top pleased with it, the idea. He also said that he had been in Rotary in Oklahoma, and his club in Oklahoma was working on a project that the Rotary clubs up there jumped in and helped them. So he's really psyched about us doing it. I'll get to a deeper explanation of them in a second. College of Healthcare Professions. That is a for-profit school. I think there's something like 7 or 8 campuses statewide. There are 2 in the city of San Antonio, one of them in an area that we were going to be working with anyway in South San Antonio, another poor area. And they basically teach students how to be medical techs. How to do radiography, sonography, take blood and things like that. And the students, before they can graduate, have to have 180 hours of practical experience. So if we open a clinic there, or if we bring them over to the church, they'll start getting their hours. So it's a win-win situation for both sides. And by the way, if you've ever heard of this organization called Rotary, the president of the 2 campuses in San Antonio is currently the president of San Antonio South Rotary Club. So again, I met him through a Rotary district leadership meeting. In Powerhouse, Jolene Garcia, who works for the city council member that I talked about, used to be the CEO of Empower House. And they would like us to work on a clinic near them. They probably won't be too involved. But again, what Jolene was saying, that would be at least one of the clinics they would help us with. So those are our 3. I'll have a 4th one when the time comes. Now, as far as the church, this is if people go out looking for a clinic, how do you know you've got a good clinic? Very interested to start. They got to go, oh my God, that is great. And to show that they have an interest in doing this, it says has a COVID clinic currently. They also have once a month dental clinic. And what we're going to do is set up two weekends out of a month to do the medical. It'll be like one day each week. 2 of the weeks will be the medical. One of them will be the COVID clinic, and the other one will be the dental. As COVID comes under control, which hopefully is happening right now, we will keep the idea of vaccinations going. Again, people that live in this area, the parents probably don't have the time, can't afford to get the vaccinations they need for their children. So we would be doing this at the church. We would take them and probably the dental clinic, put it under the Rotacare banner so that when we go out to raise money, it would look like we're part of Rotacare. 3 physicians with a 4th possible. This is like a heaven sent. There is a woman that I met at another event, another board that I'm on, and she's a retired pediatrician. And we talked about it, and I said, I'm having trouble finding physicians. And she's looking at me and said, you know of at least one doctor that'll do it. There's a friend, and she just jumped right into it. And she's got a friend there, and there's one of my physicians, again, my cardiologist, said she would do it too. And there's the 4th possible is somebody that is active military, does emergency medicine in the military. And when he's not off somewhere traveling for the military, he's going to work with us. The Seventh-day Adventist Church apparently has state conferences nationwide. The one in Texas is based in Dallas. And they have approved the idea of doing this, which was also the same as saying that as we start to approach growing, and again, the Dallas connection, that they would be involved with it. The clinic that is in Maryland is right next to the Adventist Hospital, and that's also the nationwide headquarters for the Adventist Church. So there may be a tie-in with them, which is wonderful to me. And this particular church will have room available to have health seminars. Part of the social determinants of health is to educate people And the idea would be to educate them again, blood pressure, diabetes, genetic possible illnesses, quick dental exams, things along that line. The health seminars, we would talk about what it is. You know, if birth control was something they want to talk about, we would do that. I've run into an organization that works with people that have foster children and also that have adopted the children, and they give these people counseling. So an organization like that, and they've already said they're interested, they would give a seminar to a local area about what it means to have the child, issues, and they would be there for counseling for them. Volunteer opportunities, again, I always throw this in whenever I give a slide. Again, I'm not here selling the concept unless there is interest. You know, the idea of appointing a standing Rotocare Advisory Committee. As an example, a club in the Dallas area, an area that I'm not really next to. I would come up every now and then to Dallas if we started something. But the club or a bunch of clubs would have an advisory committee, and that's where you would start building the clinics from. Participate on a Rotocare Free Clinics Committee. We will have committees on a statewide basis. There will also be a board statewide. And if we do decide to grow and there's some specialty that the person brings to bear, you know, they would be on this statewide board. Participate in Rotary District, Zone, or international meetings. That's the kind of thing I was talking about before. Until we started to break up into our own little units for now, we were planning on being at the convention. We were going to share QRAG's booth, but we're not going to do that this year. And the other one, offer in-kind support, professional services, supplies, equipment. Supplies and equipment, it's the kind of thing you get from a company, an organization like Medical Bridges, professional services. If there's a doctor in the club or the district, retired or not, if he has the time to do it, a nurse, we need a lot of nurses. Anyone that knows medical students jump at these opportunities. And on that happy note, and I'm out of breath, I rushed through it, I'm done. Any questions? No? Did I lose everybody?
One more question.
David had me muted.
If you
Did
wanted,
you contact, oh, go ahead, Howard.
if you wanted to like expand into another state, how do you propose? Like I'm in Florida, and I'm working with a lot of the districts as a speaker. So if I wanted to let them know about this, what would I tell them? And can you give us some information on how they could reach you, or what would the procedure be if there might be an interest?
In the beginning, I would be working with you, and as it turns out, in Jacksonville, I guess the Jacksonville Rotary Club has a health center, and they want to add some sort of health center, a family center. They want to add a Rotocare clinic to it. So you can talk to those people too. They've been around for quite a while. Other than that, I would help you. I would give you some ideas on who to contact. If you want me to do the initial contact, and just get me the names of the people in the area. If there are district governors that you're working with in Florida, you know, I would contact them, and I would try to set up meetings with their clubs. In the case of a district that gets really excited, I would come to a district conference and speak at a district conference. You know, for now, hopefully the way this is going to work so that it isn't just me, you know, we will be educating people to do it. People will be getting excited. I mean, as it is, I've been doing this for about 1.5 years. I knew nothing about Rotocare. I had been involved with a couple of major fundraisers years ago, but not really working with Rotocare, what it takes to open.
Did it work in another state? Because it looks like a lot of the things you're doing are Texas specific or California specific. How you would show them how to get that going in their particular area?
Yeah. Again, up until about 3 months ago, I was on a board that was looking at opening clinics nationwide. You know, and as I said, the one in Maryland is in Silver Spring, Maryland, which is a poor area. The young lady that is a physician was president-elect, and she was just kind of searching around Facebook for people that had been president of a club before, which I've done many, many times, and I'm about to do again in a year. Not the smartest person around, but she wanted to talk to me about what's it like to be a president and a president-elect. And we were done with that. I said, well, let me turn this on you. Did you ever consider starting a free medical clinic, which is really totally out of nowhere for a doctor? As it turns out, She said that she has been working with a community of 9,000 Afghani refugees. Those are, some of the people that lucked out and got out of Afghanistan. They're in a community around the Silver Spring area. As you can imagine, most of them are living in poverty right now. And they were opening a senior daycare center for them. And they wanted to open a clinic. And she is a very dedicated Rotarian. And she decided it'd be great to have a banner that says Rotacare. So she relabeled what she's doing, and she's working off our system. There is a system in place that was written about 30 years ago, and it's been updated recently, that is like a cookbook. Step 1, you do this to open a clinic. Step 2, you do this. Step 3, you do this. And that is the basis for the way the Bay Area started and the ones in Puget Sound. Question comes up, you've been doing it for 30 years. Why haven't you spread it out nationwide? As they said, I think it was either sort of a compliment or just to, play my ego to get me to do it. I like going out talking. I like going out driving stuff like this. And I think the concept of opening Rotary-based free medical clinics, is a winning situation. I mean, I've had so much positive response from people. So it's a function of trying to contact medical people, like Dr. Wu, Dr. Junta Wu is the medical director for San Antonio. My connection to her is last year I was chief of staff for the district, and I was setting up speakers for a monthly speaker series, and one of them was the mayor of San Antonio. And I just called my contacts there and I said, oh, by the way, I need your help again. And they gave me her name. So again, it was just building the network, but it was a network that started because of Rotary. Some people don't leverage the idea that they're in Rotary, but you should. It's you're helping people with it, and most people that know Rotary is like, hey, that's great. I mean, even like I said, even the pastor was all excited because of the help Rotary gave him in his church in Oklahoma, and here he is in San Antonio living through it again. So it's a function of networking and meeting those people. If you want, I will give you contact information. You want to talk about it on the phone, we can go over it and where you're going to go. All right?
Charlie,
Yes, ma'am.
I know it's only been a week or so, but have you contacted Medical Network in Tulsa?
Not yet, ma'am. I've been just swamped here. The first thing I'm trying to do is I'm trying to build up the church, but I'm also working with the foundation because I'm pretty sure that once that's done, the money's not going to flow that easily, but it's going to be flowing a whole lot easier than it's been. And money's always needed, but no, that's definitely on my list of things to do, and I appreciate that reference. And from what Linda's saying,
But also, Charlie, do you know about the state auctions they have on like Parkland Hospital and universities? They have the excess medical equipment, and you can, if you're a 501c3, you can apply for it. And if you know somebody that's in the government, they just go in within 2 weeks. It's offered to them free. A doctor could go in, say, hey, there's that whole inventory. It's on the website of what's available. A doctor can go in and get anything they want. And it may be something a university been using. Maybe it's just, it's not the latest, but it's still really good.
Sure.
We had gotten a dental chair for our clinic in Mexico and some other equipment free. And it's put out for bid then. If the doctors
pay a little bit.
they put it out for bid, and that's how we bid, and we got it for a really low price.
Mm-hmm.
So anyway, that's another option of getting equipment.
I was talking to Pat Merriweather, who I'm sure you know is the next director. And in her life as a hospital administrator, she was talking about companies that do similar things, that the companies that sell new equipment to hospitals take back the old stuff and they give it away or at a very minor price to organizations like this. So yeah, no, I appreciate that. The bigger the list, the better. Because I've got goals of having a lot of these clinics around. It's not just going to be 3 or 4. Texas being the big state that it is, somewhere in the back of my head, 20 clinics, 25 clinics. And of course the question is, where does the money come from? And my favorite answer when I'm starting a project is, I don't know, but it's out there. We'll look for it. So it's like we've got support from Rotary leadership, but legally they can't say we're part of them. So they definitely can talk, people can talk to us that have the influence, that have the networks. And people like Sunny Sharma, as an example, I don't know how many of you know Sunny. If you don't know him, you should get to know him. He's a great guy. He's going to be we've talked about him opening a clinic or two in Houston. And he had opened a clinic somewhere in Central America at one point. So he's got the skill set.
Yeah.
So these things will be growing.
Were you
I think-
online when I was talking about helping a hero and that Sonny got honored with the Lee Greenwood Patriot Award at Spring,
Yes,
Texas
yeah.
at that time?
Yeah. I saw he put something on Facebook
Okay.
to talk about it. It was an interesting night. I was impressed.
Okay, Shirley has her hand up.
Yes, ma'am.
Yes, so hi, I'm Shirley Weddle. I'm the charter president for the Suicide Prevention and Brain Health Rotary E-Club.
Yep.
Linda's our mentor. But I wanted to mention, I have a medical imaging background, by the way, so I used all that equipment that you're talking about. So there's actually two things. There's Herman Osterwick from the Denton Rotary Club that goes around like to Guatemala and Africa, and he gets a lot of the equipment from Fuji and all these other places to be able to install in those places. There's also another gentleman I know on the West Coast, Aaron Bosel, that gets ultrasound equipment and that sort of thing, and he takes it out to Africa. He's also, I don't know if he's connected to Rotary, but Herman definitely is and gets funding through Rotary for that. So I'll be glad to share that with you.
That'd be great.
And then also, I wanted to ask, of course, with mental health, we're interested in that with our Rotary E-Club, and I'll be at the International Convention, spending time with Linda as much as possible so she can take me around to meet people, but would like to connect in that regard and what we can do. We have lots of resources and a number of organizations with members in our club across 5 states so far. And then the other thing is I wanted to ask you about the San Antonio Foundation Group, because, since technically we're a 501c4, I've already had someone email me today asking if they could potentially donate to us to sponsor a class and that sort of thing. So we really need to be the 501c3 for that.
Right.
So how does that work with the San Antonio? We have Communities Foundation here in Dallas, but it seems kind of complicated to get involved with them. So how does that work?
Just for the complicated part, I've been told that I've lucked out, or I sold myself quite well. The San Antonio Area Foundation is tough to get into. Hello? Do you hear me?
No, you froze for just a minute. Can you hear me?
Yep, I can.
Okay.
We good? Okay. Again, I was told that getting into the San Antonio Area Foundation was extremely good. That's why I'm excited about it, because I can say, look what we did. We're real. Even they like us, and they will handle all the 501c3 issues. Like I mentioned, the gentleman on my board that donated the $1,000,
Yes.
he did that through the San Antonio Area Foundation. He's got a fund with them.
Yeah.
I don't know what kind of fund. You're very familiar to me, and I think we may have spoken at Dallas at Pets. Or
I
somebody
think
from-
so. Didn't you have a table there around the
I had a
corner?
table. They put me in the back corner,
Yes.
but I was very busy. You were one of the 31, 32 people that I was supposed to get in touch with. I've just been swamped. I definitely do. Now, part of what the clinics are doing is to hopefully offer at least some kind of preliminary scanning on mental health. And try to say if somebody comes to us that really needs the help and the service, if the seminars that we're going to be offering do not offer enough service, we would refer them on to somebody. There may be a way to tie that into us. The reason you would want to do that is the San Antonio Area Foundation. When I asked them, I said, in my dreams, I want to take this statewide. Are you guys going to be able to help me? And it was a vice president and just one of her assistants for donor services, or whatever the title was. They just nodded as if, yeah, of course. So that they're helping us plant the seed in San Antonio, and from there we can grow statewide. So if indeed you guys wanted to work with us, and I'm not saying you got to join us and give up your independence and whatever, but there may be a way that we can work together on that so that they handle the 501c3 part. I've never quite understood the difference between 501c3 and 501c4, and apparently even at the Rotary director level, there were major battles over whether it should be a 501c3 or 4. Don't ask. It's part of government I never wanted to touch. That's what accountants are for.
Now, in San Antonio, just to let you know, one of our members and a couple of our members actually in our Rotary E-Club were involved with them. They just had a seminar back in August, and they're doing some things citywide insofar as training for
Yep.
mental health and that sort of thing. So we're involved with them, especially with NAMI and our Rotary E-Group, and we're looking at doing some things in Dallas and connecting with them on that. We're connecting with peer groups and things like that too, as well as lots of different training with mental health first aid and all that we can offer for free.
That's exactly the kind of thing I would want to look for. If you could have them touch base with me.
Yes, or if you just want to check in with us, I mean, our members are involved in all those different things, so.
Yeah, whatever. I'm saying that's the kind of thing that, you and I can talk, and then we'll go from there and see what they're doing down here. If there's something they could work, if they want to go to a clinic as part of their operations, they go out to clinics, whether ours or the University of Texas in San Antonio has 6 of these kinds of clinics out there, and there's still need for them, so that they could, if they want to go out and give seminars to the people that run the clinics, that's fine. If they want to do it with patients, that's fine too. Whatever, but as far as the relationship, it could be built off something like that.
Okay, I have another comment. Charlie, were you in on the call or the meeting where President-elect nominee Ian or Gordon McAnally was talking? Anyway, one of his focuses is going to be on mental health.
Right.
So he wants to talk to Shirley and I when we're in Houston. So, and he said that we invited him to do a Zoom meeting and said, but we meet at 7 o'clock in the evening and that's 1 o'clock in the morning. He says that's okay. So he likes to do meetings regardless of what time. And so you can always get him to speak to your club, I'm sure.
I asked, my network, I asked somebody that he kept referring to as a wonderful woman. I did hear that talk. I was on that call.
Oh, okay.
To try to get me in front of him if possible. If you could mention what we're doing, that as the clinics grow, we are going to try to have some kind of mental health concept at the clinics. I don't know what that means, if that means treatment or if it means seminars being something that will help people understand that what they've got is an illness like any other kind of illness and they can be helped. There's a way to find solutions to it, and to family members, how they deal with it. So, I think what he's doing is wonderful. I think what he's doing at this time is wonderful for us, for Rotacare, because Rotacare will be able to use it, and it may be a way that he can leverage us to get his stuff out to clubs around the country. Because if this works right, each clinic will probably take about 2 or 3 clubs minimum.
So Charlie, why don't you come visit us Monday nights, second and fourth Monday? And we have groups from MetroCare in Cohen that work with veterans. We have school systems. We have Halliburton Foundation, all those different groups. We have members from all those areas.
Could you, again, send me a link on that?
Certainly. I'll just add you to my list.
There you go. Please. Yeah, please do. I don't know if I can make every meeting, but...
That brings up something else. You have a list of people you send out to. Do you have a separate group list that you make up? Because we were talking about this earlier. There's a lot of people we'd like to invite to the meeting. Each time, instead of doing each one individually or having to go through each time, do you have a group list, and how do you do it? And can you let Howard know how?
I don't have a group list yet.
So it's surely late. Yeah.
Yeah, what I've got is practice networking. I love networking, and as you can tell, I love talking.
Yeah. Well, Shirley sends out an email every week or every 2 weeks, and she has a whole list of people, and some of them are not necessarily Rotary members, I don't think. Are they, Shirley?
That's correct. From other organizations, I invite them as guests and stuff like that.
So how do you do that? Rather than individually, do you have a group where you just send one email and it goes out to the whole group?
I have a group of our club. I have our club email group, which is, over 50 people.
But just people that are not Rotarians.
Yeah, that's another group. I send a second email.
Okay, and how do you automate that so you don't have to send it out that you have to go back and look at each one's email each time? That it's all in one group.
I copy paste. So,
Oh, okay.
yeah, so we're
Okay.
looking at using MailChimp, but we haven't gotten that all set up yet with the input with all the names and that sort of thing. So it's just been as easy to copy paste each group. So
Okay.
that's what I do each time.
Okay.
But the thing, you can only send to so many people at one time, and that's when I got locked out of my email when I sent to too many at one time. That's why I break it out. So I have
Okay.
Rotarians, our club Rotarians, and then non-club Rotarians and groups from other folks from other areas.
Okay, we have a guest on, Zoom user. Sir, can you unmute? Zoom user with skating or something in the background?
Hello,
Can
it's Christopher Hayden.
Oh, Chris, good to meet you. He was
Yes, I was here last
interested in
time.
Rotary. Yeah, he was one of our leads from Rotary. So glad you can make it tonight.
Welcome.
Yes, thank you.
Hope you enjoy it.
Almost definitely. I enjoyed the last one. That's what made me come back.
Okay, I will send you another invitation for the next time. Like I said, the second and fourth Tuesdays.
Yes, ma'am. Yes, ma'am.
Okay, and just remember, put this on your calendar. On July the 12th will be our official visit by our district governor, and our installation of officers. And also, it will be at Richard and Roselle Gilman's home.
And Shiloh will be there.
Yeah, and Shiloh will be there, and I'm going to honor him. And anyway, I just put July 12th on your calendar. We'll be putting his address out closer to time, and we need to know as soon as you think you might be there. Let us know so Rich will know, and I'll know how much food to purchase and see how much we can charge you.
How many avocados?
And how many avocados that David needs to buy, because he usually makes guacamole. So, and Belinda and Mark, it was great seeing you online. And let's see, Jerica had to leave because they were getting ready to go into dinner. And we haven't had dinner yet. So,
let me roll it
anyway.
up then. I'll do the four-way test. Is it okay?
Okay.
Let's do the four-way test of the things we think, say, and do. First, is it the truth?
Is it the
Is it the
truth?
truth?
Second, is it fair to all
Is
concerned?
it fair to all
Fair to all
concerned?
concerned.
Third, will build goodwill and better
We'll build
friendships.
goodwill and better friendships.
Fourth, will be beneficial.
Will be beneficial to all
And
concerned.
that one is, will be fine. Well, thank you, everybody. See you in, let's see, this is the second one. So our next one is the second Tuesday in June at 6 o'clock
Right.
Central. Invite some friends. We're trying to grow the club. So if you know of people who might be interested as guests to come, we welcome them. Thank you. Be well.
Thank you.
Stay safe.
How are